Hi, this is Unit 3 in the Program and Project Management course for African Mission Healthcare. And we're going to start getting into the meat of the materials here. And I apologize in advance if this gets a little monotonic, but it's much more lively to do it with a live audience rather than the reflection of a computer screen. But let me start off with definition and planning, and really the definition part of things. The first artifact that we usually create in project management is a project initiation document, or a PID. And it's something that we use as a way of making sure that all the key stakeholders and participants in the project are trying to achieve the similar set of goals. As Lewis Carroll said, if you don't know where you're going, any road will get you there, which is one of my favorite quotes of all times. But the project initiation document really is something that's created as soon as a leadership team or a group of people decide that we have to take action and that the action requires some forethought. And the key sections of a project initiation document, and we'll go through a detailed example in a few minutes, are the goals of what we're trying to accomplish, a description of what the project is about. Sometimes a short description and a long description are needed. Scope boundaries, what's in and what's out. So if you've got a project plan to paint one of the buildings on your campus or at your institution, saying which rooms are out of scope and aren't going to be painted and which ones are in scope would be a simple example of a scope boundary that we could all identify with. Uh, a business case. And a business case isn't always about the economics. And at this point in the process, it might just be an order of magnitude. But the business case articulates the costs and the benefits associated with the project that we're talking about. So we might think we need 5 people for 5 months to do the work. We might need 1,000 shillings of out-of-pocket expense. We might need sort of part-time resource and access to key experts to get the project done. Those would all be kind of inputs for the business case. And then we have benefits that we're trying to attain. Sometimes the benefits are in human terms, like we want to improve patient satisfaction. And sometimes they're in economic terms, like we're trying to improve our efficiency and go from doing 10 of something per month to doing 15 of those things per month. Or maybe the benefits are related to human benefits. So we might say that we want to improve customer satisfaction or patient satisfaction 10%, which we think will increase revenue by a certain amount of money, as an example. The next bucket are an assessment of the key stakeholders and the priorities and the constraints. And sometimes the priorities and constraints are considered in the context of each stakeholder. A stakeholder is anybody who cares about the project and either has something to gain or something to give in the project. Priorities are the things that are most important and a key focus for all good managers. And constraints are something that we need to recognize and minimize to the extent we can. And oftentimes, right up front in the PID, we're able to think through and dialogue about the key constraints and what we're going to do about them. Anytime you undertake a project, there's risk involved, and forethought into what the key risks are going to be and how we're going to mitigate them is very important. And a very related topic are key success factors, things that have to happen for us to succeed. And those are grouped together because they're sometimes quite related. We want to have a definition of success that uses some metrics. Now, metrics are useful but imperfect. So we might say that, we're going to have a project to, get a field ready and plant maize. And success might be getting the field ready and growing maize and seeing maize plants grow. But a more detailed metric would be what what volume of maize do we hope to harvest from the land? And that metric, the more precise we can be with that metric, the better definition of success we have, and it helps us make decisions during the project as to how we're going to execute the project. And sometimes it requires us to add buffers. For example, rather than an acreage of maize field, we might have an acre and a half, because to achieve our volume goals, we want to give ourselves a little bit of an extra buffer. And the last piece we always consider at this point in time are high-level team organization, and different projects require different levels of organization, and different projects require different levels of bureaucracy, have different decision-making layers, and different degrees of politics that are involved. And I've never been in a project yet that didn't involve some politics. So we'll spend some more time talking about that. I use the term artifact up front, and just to make sure that's clear to everybody, it's meant to be sort of an archaeological document or deliverable from a project plan that is visible to all parties, that all parties can provide feedback into, and it provides what we call traceability. But 3 years into a project, it's always good to go back and read the project initiation document and, quite frankly, change it as necessary, but remind ourselves what we were at first trying to accomplish. Even on shorter projects, that's a very important role. So I've come up with a more detailed example, and then we'll end Module 3 now. After that, and it's a project it's a real project. It's not one that I was particularly involved with, but that I learned about from others. And the project initiation document that I've put here is pretty close to what they had when they actually did the project. But it was a better patient intake project. And really, there were three goals documented. One, they wanted to improve the customer experience for the patient. They felt that was necessary to differentiate themselves. They wanted to get complete and more accurate information. They found that information collection was spotty, and the accuracy of the information being collected wasn't all that great. And part of their continuous improvement meant getting better data right up front. And the third piece was they wanted to effectively triage severity and make sure that the people who are in need of absolutely urgent care get it, but that the people with more urgent needs are put ahead in the queue relative to people with lesser needs, while at the same time making sure that nobody spends too much time waiting. So that was a fairly complicated goal. They decided that the scope would include patients that were arriving for both scheduled and unscheduled care. They could have left one or both of those out, but they decided to include both. And they wanted to include the family, and the customer experience from the family's lens, not just the person that needed the care. So that was a scope boundary they decided upon. Now, sometimes the most interesting scope boundaries of what we decide to leave out. And in this case, they said, look, we don't want to change the way we assess financial need. The feeling was that that was working okay, and that making changes to that might not only not be necessary, but might create risk that they didn't want to take on. So, nuance of that particular project. Key stakeholders, clearly a project champion. A champion is somebody who's senior in the organization or institution, or maybe in the community, maybe in the customer base, and somebody who doesn't spend a ton of time supporting the project, but sort of inspires and also helps to remove roadblocks. Project leader is somebody who's spending at least half and maybe full time on the project, and sort of the single person you would go to when there's feedback to be given on a project or to understand the progress of the project. So the project leader is a very important position. Um, you know, Current and future patients and their families are important stakeholders. The intake staff, the employees that do the intake, and the volunteers, very, very important. Um, Downstream care providers, so the doctors and nurses and technicians that might be interacting with the patient after they're logged into the facility, are very important customers. And even ambulance personnel, anybody who is bringing an injured party to the institution is an important customer as well. And I bet you could all think of additional stakeholders as well. The key priorities for this particular project was, clearly they didn't want to have any urgent case not get handled quickly enough. So that was a very important priority. They wanted the patients and their families to feel welcome and have accurate expectations for what was going to happen to them when they were at the facility. And it's a basic mantra of good customer service that you kind of set accurate expectations and then you meet them. And if you find along the way you can't meet the expectations you set, you proactively tell the customer about that. And we can all think of examples in our own lives where either our expectations were wrong or our expectations were initially accurate but became no longer possible. And it's always better to have proactive knowledge of that than to be surprised fairly late in the game. So a good mantra for customer service. They wanted to collect information that helps us treat the patient today and in the future. That was a key priority, of course. And they wanted to make the intake role more rewarding for staff, and including the employees and the volunteers, who sometimes, were feeling poorly valued and didn't find the work all that interesting and exciting. So they wanted to build engagement with the intake personnel. Key constraints, they couldn't increase the staffing model. If they had 3 or 4 people who did intake, they couldn't go to 4 or 5. There wasn't any additional money to pay them. And also another key constraint, while executing the project, we couldn't take staff away during the working hours. So we had to find a way to train them and get them ready for the new process and model without taking them away from their day-to-day responsibilities. Additional aspects of this project initiation document, key risks. And these are just a starting list. And subsequent to going through this example, I think it's good to pause with the attendees of your training and go through this exact process for a project that's important to them in 15 or 20 minutes time. So it's best to get out of lecture mode and make this quite interactive if you haven't done so already. Key risks, though, would be, we break a process that works okay today. Oftentimes there are unintended consequences, and we don't intend to break it, but by fixing something, we actually end up creating more problems. Lots of examples of that. We could alienate patients who are anxious about the information we're collecting. Oftentimes if they're in need of care, they want to make sure their care is received. And a lot of questions may seem unnecessary or counterproductive to their goals and objectives. And we want to make sure that we don't alienate patients in our pursuit of additional context and information. We also could create too much bureaucracy and paperwork to maintain efficiency. Oftentimes, the focus on an individual sub-process like patient intake ends up creating and over-engineering the machine. And while we may start with an under-engineered patient intake process, we don't want to create the opposite and have something that's bureaucratic and wasteful. Key success factors, getting the right balance of service to the customer and our needs to provide care. So it's a question of balance. The patient might just want to be taken right to a doctor. That might be perfect service for them. But for us, we only have so many doctors, and we need to collect information to make sure we get them to the right nurse and the right doctor and the right care professionals that's suited to their particular needs. Um, Second is, really wanting to understand the needs of patients and the variation among them. All too often, customer services, we make assumptions and we have beliefs, and they may be roughly accurate, but they're not very nuanced. And by understanding the variations in different patient needs, we're able to better meet them and serve them, and take a more thoughtful approach to interacting with customers. Implementing the findings in an unobtrusive way is the third key success factor. So we can't, disrupt the operations of the hospital in our efforts to implement a new patient intake process. The definition of success, where we try to turn some things into metrics. Not everything can be turned into a metric, but clearly customer survey results, in particular if we have a baseline. Clearly, we can do audits of information completeness and accuracy, starting with a baseline before we make any changes, and then comparing it to after the project to see if we actually are receiving more complete and accurate information. And employee survey results, right? Employees and volunteers should be providing us feedback, and it's useful to have a baseline, but even if we don't, it's useful to kind of get a sense and give them an ability to reflect on their job, about the process, and make sure that they feel engaged and are listened to. High-level organization we're going to spend some more time on later. It's always something good to think about in the project initiation phase. The only thing I'm going to highlight here is the project coach, which is a very useful thing in any institution to have somebody who is not the leader of the project, but somebody who has some management experience and things like that, coming in from the side and helping coach the team and the leader and how to be more effective. We use that in my business very extensively, where somebody who is not as vested in the particular project can be a little distant and be able to see things that those of us too close to the project might not see. And there's a lot of interpersonal skill that's required to lead a project, and we're not all perfect. So a coach can help you develop styles that are going to be more or less effective in a situation. We'll wrap up this Unit 3 reflecting on trade-offs. And when I think about the best leaders and the best managers I've worked with, I reflect on their ability to identify and make trade-offs. A trade-off being, a choice or a balance that needs to be accomplished between two desirable but incompatible features, some sort of compromise. Now, not everything is a trade-off. Sometimes, for example, doing something faster also is doing something better for the customer. And so that's not really a trade-off. But sometimes doing something faster is not as good for the customer. And answering their questions might be an example. The speed with which you can get them to a primary care person, that is directly related to their satisfaction. But the speed with which you try to answer their questions, if they have questions about their care, that's a trade-off. Now, as a caregiver, you have lots of people waiting to see you, so you can clearly see the value in finishing up with one patient and getting to the next patient quickly. But there's a trade-off there, because that patient may have lots of questions to ask you, and you want to give them individualized answers and things like that. So when you really look at the best project managers and program managers, they're the ones that proactively identify these trade-offs and manage them accordingly, and put mechanisms in place so that they can track when the trade-off isn't being well balanced. So a good thing to do now with the group is to talk about some examples of trade-offs that exist in your day-to-day activities.